This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hello, and welcome to Common Health, a podcast brought to you by the Virginia Community Healthcare Association, or VCHA. I'm Tracy Douglas, VCHA's CEO, and your host for this episode. On Common Health, we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by community health centers here and those who serve them. And once again, listeners, we come to you with a great story, two great individuals that we are bringing to the table so that, again, remember listeners, we do this show for the purposes of not just educating and providing some FYIs to anybody here who's listening from Virginia, but really for those individuals who are listening outside of Virginia or even the country. We do have some listeners in other countries. We like to bring some of the good work that's being done by organizations, individuals that are really making a difference in our communities when it comes to healthcare and bringing healthcare to the communities. And listeners, as you know, Virginia Community Healthcare Association is the association that represents all the community health centers, that's federally qualified health centers and lookalikes, which we call safety net providers here in the state of Virginia. And we just really feel it's important that, as you know, listeners, we are able to spread some of the good work that's being done. So with that, we've got two individuals from an organization that we work with very closely, as well as some of the community health centers. And the name of the organization is called Mission Mobile Medical. And today we have with us the CEO and the CRO, which we'll ask more about that, Travis LeFever, who is the CEO, and Brad Watson, who is the CRO. And we're really excited that they've been able to take the time to meet with us and have some conversation today. As the Chief Executive Officer, Travis, has been an advocate for universal mobile medicine. And let me tell you, listeners, he really is an advocate for mobile medicine. And again, we'll get into what is mobile medicine. And he created the methodology to increase equitable access to healthcare for marginalized communities at low or no cost. Travis holds an MBA from Carolina University and a postgraduate certificate in marketing from Cornell University. He is a committee member of the Remanufacturing Industries Council. So we got to learn about that. For Brad, as the Chief Revenue Officer, Brad pioneers mobile healthcare solutions that help communities across the country launch and sustain their own mobile clinics. Brad is a recent graduate of Harvard Medical School from their Global Health Leaders program and is a founding member of the Global Healthcare Leaders Foundation. So, before we get into some conversation about the work that you're doing and about mobile medicine, I really think we should have like an icebreaker. And icebreaker meaning that, we're in the summer months. I'm just now coming back from vacation and we're talking mobile and mobile clinics and things like that. So I got a question for both of you guys. Tell me, what is your dream road trip vacation?
Well, Tracy, thanks so much for that glowing introduction. I'm not sure who to pay for writing all that amazing stuff about Brad and I, but thank you. And just, we're honored to be invited into the space and to, have a conversation for a few minutes about the work that we're being done, that is being done, not just in our organization, but yours. Like you are leading the fight there in Virginia, and we're just so impressed with what you and your team and the health centers are doing up there. It's absolutely amazing. So icebreakers, I'm gonna let Bragg start.
Yeah, so I hesitate to say dream road trip because I have 3 children, 2 of which are teenagers, and I'm not sure if they would view it as a dream. But my wife and I have talked for the last few summers about how exciting it would be to take our children really out west for them to really it's hard to grasp how large the country is, and particularly the Southwest and then up into Wyoming to like Yellowstone. That would be something that I think would be exciting. I have access to vehicles that most people don't to help us along the way. But we will see if that comes to fruition. I've got to get my teenage daughters to buy in.
I get it. And next?
So I didn't do a great job of preparing for the road trip icebreaker, but I will say, some of the things Brad was talking about during the middle of COVID, we were awarded a contract from the microbiological laboratories in Canada. And as part of that, we had to pick up a vehicle in Las Vegas. And there's, big shutdowns. My kids were out of school. I have a son. He was 24, 23, then maybe even 22. It's been a minute since COVID, I guess. And he and I flew to Las Vegas and picked up this vehicle, and we drove back across the country, which was amazing just to get to spend some time, without electronics, without, his sisters yelling at him, and, just, me and him. And that's probably one of my favorite memories. And so my dream road trip, it may be to get the opportunity to do that with my other 2 kids at some point when they're, kind of young adults, starting college, old enough to talk about serious things and still have a little bit of fun. So that's my icebreaker. Yeah, great question. Thank you.
Yeah, that's great. Yeah. And I will tell you, my dream trip is, and I'm telling you, I am going to do this, that we live in a beautiful country. We have states with just beautiful sceneries and great culture. And I really would like to experience more of the beauty that exists here in the United States. And so, me and my husband have actually talked about the idea of getting a mobile unit and maybe getting it on the road and checking out this country. So that's really kind of my dream. That's my retirement dream. How about that? So I don't know when that's coming, but that's my retirement
we have
dream.
A group that we call our road show that are on permanent retirement / maintenance circuit all across the country, visiting our alliance members, our client base, and doing miscellaneous maintenance stuff. And they send back the most amazing pictures. So whenever they're ready to sort of give it up, they're a retired couple. Whenever they're ready to give it up, Tracy, I know who I'm going to call.
Hey, just teach me how to do the screws and the starter and the unit, and we got it going on.
A handful of things you need to know. So I got you.
Right. Okay. All right. I'm going to take you up on that. Thank you. So, listeners, let me just kind of talk to you a little bit about mobile medicine. Okay. And when we talk about mobile medicine, so, for those of you that go visit your doctors, you go to their office so that you can see your provider. And so from your perspective, right, you do what you can to get to your provider so that you're able to, continue to get your prescriptions, or if you're not feeling well, etc. Well, Many community health centers, not just in Virginia, but throughout the United States, have made some investments for years now in, we call it now mobile medicine. And that is, they think big RV that's been converted in some respects to a provider, a physician office, and they take that on the road. And you find a lot of community health centers listeners making that investment, especially around a lot of the rural communities, because our rural communities really do struggle and have challenges with transportation. When we live in urban settings, we have access to a lot of times the Ubers and the Lyfts and the bus system or subway system. But there are many in our rural communities that don't. Now, you will see some mobile units also in the urban and suburban settings as well. But we're really starting to see more of it in the rural settings and also at our schools. You will see many community health centers with their mobile units at a high school or a middle school or an elementary school. And so what we do is working with Mission Mobile. Mission Mobile actually is this organization that we've, as well as other health centers, have partnered with. And they, to us, are the subject matter expert, right? And I have learned a lot from this group. I just, at the end of the day, I look at it, it's the mobile unit, whereas Mission Mobile Medical, they don't look at it this way. No, there's more to it than just this unit. And so I want our listeners, I want you listeners to kind of learn what goes into these units and why do we have to pay? Why does this organization exist? And why do we have to pay attention to some of the things that this organization does for our mobile units? So, Travis and Brad, can you talk to me about why did you start this organization? It's a new organization. It's newer. I've shared with the listeners why we felt it was important that we have a collaboration with your organization. But share with my listeners, our listeners here, on why did you even think about starting up an organization such as this?
Well, it's an important story, not just to me, but to the country, honestly. And it goes back to, like you say, we're only 4 years old, 4.5 years old. We started right before the pandemic. So in the summer of 2019, I found myself in a turnaround contract with a specialty vehicle manufacturer. And I don't know if you know what a turnaround is, but it's when a company's about to go out of business, they'll bring in somebody like me to do a big, sort of sales, marketing, and operations effort and try to turn it around. And so as part of that effort, we landed some pretty big clients. So we had Oscar Mayer Wienermobiles, we had Facebook, Caterpillar, Procter & Gamble, the U.S. Navy, Lockheed Martin, Siemens. I mean, you name it. When I say we built specialty vehicles, we were big boys, right? But one day, these two ladies from Wake Forest Baptist here in North Carolina came in our office and asked, they were Rachel and Sharon, and they said, "Can you build a mobile clinic?" Well, our motto was, if you can dream it, we can build it. And so we were like, yes, of course. And I went to work. We put together this proposal. We considered, shuttle buses and vans and box trucks and all the things we could find on the internet. But we ended up with this proposal for a custom coach. It was $650,000. It's going to take about 18 months to build, which was all great, right down kind of industry standard stuff. But when I took it to Rachel and Sharon and showed them the proposal, they laughed at me. They said, "Travis, you really don't have any clue of what we're trying to do." And they began to educate me on how some of the most vulnerable people in our state live down the street from us, and we never knew it. And so what Rachel said was, "Hey, I have a grant. I have $250,000. I've got till Christmas to spend it. What can you do?" Our engineering team said, "Look, the only way you can get a mobile clinic for $250,000 in 6 months is if we remanufacture an RV." And when I asked Rachel about it, she said, "Hey, I told you we're not fancy. It's out of the sun, out of the rain. It has to run every day. If you can do that, then that's what we want." But the moment, Tracy, that really sort of, I remember most about that experience, and the moment really that changed my life was the day we signed the contract. Around the conference table, we signed the contract. Everybody was kind of shaking hands. But Rachel came over and gave me a big hug. And I remember very distinctly thinking, this is the first hug I've ever gotten at work. And then she started like talking to me. And I don't know if you have ever had someone talk to you while they were giving you a hug. You have to listen, right? And you have to lean in. And what she was telling me was that, thanks for doing this. It's hard to find people to help her, to make this reality. And then how she was going to take it up into the mountains here in North Carolina. We got the Appalachian Mountains, and see people who don't trust the doctors or who can't or won't drive an hour down into town. And the reason that struck me was because a few years prior to that, my father had passed away. And when she said, "You won't know what it's going to mean to the people that we're going to go see," that was my people that she's talking about. Like, I grew up in the mountains, and we had a big farm family. My 6 uncles, they're all chicken farmers, and they're all farmer tough, right? They say the hospital's where you go to die. Don't go to the doctor, Travis. They'll find something wrong with you. And those attitudes like carried my mom and dad their whole life, and they wouldn't do it. My dad, one day at work, he's in a storage room by himself and just has a massive heart attack, right? And 66 years old. And that's not fair. Honestly, it's not fair to him. It wasn't fair to us. And he didn't deserve that. He was a good man. He raised us right. And so what Rachel was telling me, really, all I could think about was my dad, and how maybe if somebody like Rachel had came to his little town, parked at the church or the post office, and treated him like a person instead of a profit margin, that maybe he would have listened, right? And maybe we would have got a few more years with him. So I took this sort of like, okay, I'm hooked to that organization, and I tried to talk them into doing more mobile clinics. Like I said, we were big boys. We could really change the world. And they said no. And I said, "Oh, you just don't understand, right?" And I showed them all the research and the reasons it was good for our company, our community, our country. And they said no. And me, I can't be quiet. And so it just got so, tense that on January 10th of 2020, they fired me. And so I go home, right? And my wife, you don't know her, but Amanda, I'm thinking all the way home, what am I going to tell my wife, right? And
Right.
Amanda's funny because when she was a kid, she went through some stuff, kind of like we all do, but she came out the other side of it with this idea that the worst feeling in the world is to feel like you're alone against the world. And so whenever I told her, like what we were doing, and or that they had fired me and this idea, she looks right at me and goes, "We should just do it." And so we cashed in our life insurance, and we started this company in March of 2020. The very first week of March, we incorporated. I don't know if you remember what happened the second week of March in 2020, but that turns out not to be a great time to start a business.
Yep.
I wouldn't recommend it, but I'll say that it turned out well, because we started getting calls, and it hadn't stopped since. We average about 75 calls a week here, people wanting us to help them start mobile clinics. So that's why we started the company, and we did it yesterday. We're going to do it today, and we're going to do it tomorrow. We don't have anything better to do. We haven't found a better way to live. So here we are.
So can you tell our listeners exactly what does Mission Mobile do?
For sure. Go ahead.
Yeah, so we are an evolving organization. We started out in the spring and summer of 2020 with the idea and the hope that we could sell a couple mobile clinics to a few people, for the few people that were in the room. And as time has evolved, we really realized how significant the challenges to access in our country are. And, I've been very fortunate personally in my life to not have experienced those challenges, but I've learned a ton over the last 4 years. We started off building and selling mobile clinics, and we're in the midst of evolving to be a mobile healthcare company. So I was our very first salesperson back in the summer of 2020, and I've been fortunate enough to go on a lot of the early deliveries, and I've gotten the hugs, and I've seen the tears, and I learned very quickly what these mobile clinics mean to the communities that they're serving. But I also continue to hear story after story, much of the time from community health center people across the country, where they struggled. They got some opportunistic grant and were able to purchase a mobile clinic, but they didn't know what to do next because they didn't have bandwidth. They didn't have workforce. They didn't have a driver. They didn't know how they were going to take care of them. So along the way, in addition to the building and selling mobile clinics, we added layers to our service menu, added more value. So it started with service and maintenance. So we have a network of 14,000 folks, some internal, mostly external across the country, that take care of our partners, our alliance, take care of their mobile clinics, oftentimes where they sit. So we're changing the oil and we're changing the filters, and if a button breaks or something gets a little wonky, our team takes care of it for our partners where they sit. And then folks said, well, that sounds amazing, but I don't have an operator. I don't have a driver. Okay. So then we said we can add additional value by doing two things. First off, if you get someone with a little bit of courage that's willing to go through a little bit of training, we'll coach you up. Come to Greensboro. Our team will spend as much time as you need to get you comfortable, how to drive, how to park, how to set the clinic up for event mode, how to break it down for transit mode, and the 4 or 5 things that we see that typically cause challenges in the field. So we added that, and then we took it a step further. It's like, you know what, we'll provide you an operator should you need it. And that person is going to take off the Mission Mobile Medical shirt and put your shirt on and help your clinical team with patient registration and triage, in addition to maintaining care and custody and control of the mobile clinic itself. And these folks are typically, they have a clinical bent. So we started off using EMTs and paramedics. They've got that clinical focus, but also pretty comfortable with the equipment. And there was an appetite for that from a lot of our partners. And then the next thing was, well, this all sounds so amazing, but I don't have the clinical staff to run a mobile clinic. Like, we have significant workforce challenges. It's like, well, we can add value in that way by helping you with clinical staff, adding nursing to the mix. And so over the last 4 years, we've evolved from a specialty vehicle manufacturer to a mobile healthcare company who happens to build its own equipment. And that evolution, it continues today. And the thing I'm most proud of over the last 4 years is that along the way, we've attracted folks that are much bigger, faster, stronger than I'll ever be. And they have made our organization so much better. Many of them were clients of ours who saw Mission Mobile Medical as a platform to really take their work beyond just their community to help the 50 million, 60 million, 70 million of our neighbors that lack access to healthcare.
And then, Tracy, I think, when Brad talks about it's continuing to evolve, like adding the coaching services, to help planning, to figure out the funding, building the financial models, and then most recently, and this is maybe breaking news to some of your podcast listeners for sure, so trying to add value there is, we have a project in the works to develop a research consortium, so mobile healthcare research consortium, and we've got some founding members on board, some names you'd recognize, academic research universities that and some agencies that are absolutely stoked to be able to collaborate in researching rural communities using mobile clinics as the platform. And so that is going to be amazing on top of all the other opportunities, right, that we get to help folks. That is one of the ones we're most excited about. So
Yeah, again, listeners, as you were hearing Brad and Travis talk about what they do, all these areas that they touched on that Mission Mobile does are things that I will tell you, I've been in health administration for a very, very long time. I've been around a number of mobile units, but the way they broke it down to me like this was quite eye-opening. And let me tell you why, listeners. When a healthcare provider, community health center, opens its doors to begin seeing patients, community health centers are committed to the health of their communities. They want to keep them and make them help what they need to do to help get their communities healthy. And if any of these health centers were to shut their doors, think about the impact, right, that that community is going to go through. So same here with our mobile units. Many communities, especially the rural communities, become very dependent on that unit that's going to come that Tuesday, that second Tuesday of every month, right, at whatever school or wherever they park that unit. And if that unit is no longer available to be able to make that run, then that means that community doesn't have the access to the provider for that given day. And so what Mission Mobile does is help these units to continue to run, right, to be sustainable. And it's not just, the engine turning on. It's like what they shared. It's a multitude of areas within the mobile unit, within the mobile program, that we've got to ensure that it keeps running. And so we are very thankful that we have an organization like Mission Mobile that does what it does. When you guys got into this business, when Rachel, the nurse, who really kind of planted the seed, and we have to thank Rachel. Rachel, if you're out there listening, please, we want to say thank you for having that meeting with Travis. But, I'd like to hear from you guys, given your experience now with working with many mobile programs out here. What have you been hearing, or what did you hear initially from the communities that were struggling with accessing healthcare services? Look, I want everybody to understand these are hard-working individuals that live in communities that struggle with transportation, okay? And so can you guys share with us, what are some of the things that you have heard over the years since you became existed and are working with many of these mobile programs? What were you hearing from the communities before these units became available and now that the units are available?
It's a great question, and I don't know that I could speak to kind of before, because obviously those are communities we're not involved in. But we do hear story after story of thank goodness, right? Like, thank you. Like, so communities are thankful and grateful that they get access to care. When we look at and are in planning mode with some of the health centers to figure out how to make these programs financially sustainable, we look at geographies, and what we have delineated geography into a low effort visit zone that's about 15 to 20 minutes away from the nearest access point. And then there's another circle bigger than that. It's about 60 minutes. We call that the high effort visit zone. And we, it,
So
sure.
Travis, if I could just interrupt you for 1 minute. So for our listeners, you said
I'm
from the
sorry.
access point, right? Can you describe what is an access
A
point?
health center may have administrative offices, locations where they see patients, and then also satellite clinics where they may only have one or two exam rooms or are only open, 20 or 30 hours a week. And so we consider that a healthcare access point. It's infrastructure for our country. But then from there, you can imagine 20 minutes, 30 minutes further, if a person lives 30 minutes from that nearest access point to healthcare, they are and either need a preventative type of visit or are feeling bad. They make a calculus like we all do, right? Of how convenient is this? How affordable is this for me to make this trip? And for a single mother, physically handicapped individual, an elderly person, there's always this weighing that's going on of, is it worth the trip and the money? And to put it in perspective, imagine that you live twice as far away. So now all of a sudden it's really inconvenient.
Mm-hmm.
And what we believe is if you look at, kind of an area around the most remote access point, and you add a mobile clinic in rotation, sort of every direction away from that access point, you transform a high effort visit zone into a low effort visit zone. You transform an inconvenient calculation in someone's head to a convenient, and by proxy, you make it more likely. It's still not a guarantee that they'll visit, but it's far more likely that they'll visit the closer you are. There's geographic challenges, there's financial challenges, there's social challenges. Being in someone's community, their community, is significantly different than expecting them to drive into town and visit a stranger, a doctor. So, I just hear gratefulness, right? That we're having a real impact on how convenient we're making healthcare, and also, I just want to point out that we are fans and supporters of the health center movement. There's tons of convenient care, right? Walmart's try to do it, CVS is try to do it. Like, that's not the convenience that I'm talking about. I'm talking about a safety net healthcare provider, someone who's providing a medical home, not just a retail service. And those are great, right? I don't want to get think that they're not. But these rural communities, there's a significant financial burden, and elderly folks are not getting any younger. So that's whenever I say increasing convenience, not just convenience, but convenience to people who care. And that's different. Right. And we all know that health centers provide the most effective, the most efficient, high quality care. They're the partner of choice, the workplace of choice. They're just good people. The people I meet in health centers are the salt of the earth, and it gives us no greater pleasure than helping them help their community. And to be honest, one of the reasons that I do a lot of this work is because I miss my dad, right? And all I can think about is, can I help somebody like Rachel, or health center, someone go help someone like my dad who lives out in the country and wouldn't move to the city if you paid him $1 million. He's not going to do it. So I think it's gratefulness, to help. Somebody cares.
Mm-hmm. And I look at mobile health, right, as bringing healthcare to the communities, as opposed to the other way around, right? The communities having to go. To me, I look at that as kind of the old way of providing healthcare services, right? We live in a world now that's very fast moving. We've got tremendous access to information. We no matter how rich or, where you come on the income status, someone has a cell phone, right? And they're able to take advantage of a lot of the information that is coming into as well as going out. So, I look at this as you use the word convenience, Travis, right? I actually am going to flip that a little bit because I look at mobile health as a necessity. Just like I look at healthcare in the community health center as a necessity, I look at mobile health as a necessity now. We have to have this. And that's why we are so grateful that we have an organization like Mission Mobile, because we have many, many health centers as well as we've got health systems that are investing in mobile units. And they're every folk in the healthcare industry are looking at this as this is a necessity. If we don't have a mobile program, we have to get a mobile program. So what are some examples? I think it would be really good for you to share with our listeners. Where could people find a mobile unit?
For use or sorry, exactly.
For use in a community. So where would be some examples of where they could find a mobile
another great
unit?
question. I think that there's kind of two ways, and one is the patient is looking for the mobile clinic, and so we all use the Google machine, I think, as it's been termed, and so it's just online search for Safety Net Health Center mobile, and most health centers have them listed on the website. They pop right up with a calendar and or a scheduling type of link. The other thing that we recommend in kind of our coaching and planning process is connecting with social services and 211. And so any of the health infrastructure and the healthcare providers in the community, if we do a great job of communicating, creating awareness around the mobile clinic, providers should refer, even brick and mortar providers should refer people to the mobile clinic. So it's really an interesting thing. We also recommend that health centers undertake a 2 or a 3-legged campaign for creating community awareness and publishing their phone numbers. So social media campaigns, for example, geofenced into the zip code. I believe that almost everyone among us, right, is between the hours of 8:30 and 9 o'clock at night, or on either Facebook or Instagram, or one of these social media tools, checking in with the world. And it doesn't take long for folks to become aware that there's a mobile clinic. Here's the link, and here's how you get an appointment with that provider. We also have them look at, when they are talking about, creating awareness who that mobile program is for. Because there's tons of use cases, all the way from, podiatry to optometry to primary care, cancer screening. Like, there's a tremendous amount of things that people use this space for. And whenever you're driving awareness, you don't just want to advertise that it's a mobile clinic necessarily. There's already in our country a little bit of a stigma of using a free service somehow. But if you're advertising that, hey, if you're a man who's 50 years old who has never had a skin cancer examination, or hasn't had a preventative wellness visit in the past 18 months, that's what happens in here. That's what we do. That's what we're bringing to your community, is this availability. But it's who it's for, not what it does. Because honestly, if you put cancer screening on the side of your mobile clinic, guess who's going to walk in? No one wants to, right? Like, there's this aversion. But if we talk about who it's for instead of what it does, and why we're here to create wellness in the community, and honestly, like the school-based clinics, like, we think that is the path to power in rural healthcare, the school-based health clinics. And using the mobile clinics, you don't have to give up. The school system doesn't have to give up any square footage. Yeah, and so there's no construction, there's no permitting, there's no any of this sort of stuff. The mobile clinic does the heavy lifting, and then it's what we look at as a kids first, family focused healthcare and wellness program. And if you can launch a kids first, family focused health and wellness program into a community buoyed by the credibility and convenience of the school system, you've really got an opportunity for a health center to really have an impact in a county or a set of counties. So we see that as a path to expansion for health centers, a path to financial sustainability, especially when you're working with us and you don't have to buy the mobile clinic or you don't have to do all the dirty work. Man, the school-based health stuff is where it's at. In fact, I'm going to be in West Virginia on Thursday speaking to their PCA and the mobile health. And that's all we're going to talk about is how to bring school-based health through mobile clinics.
What are some examples of the kind of services you would see?
Yeah, absolutely. So as Travis touched on earlier, it's really a broad range. What started off with our focus largely on primary care. We see tons of dental screenings. A lot of the school-based programs Travis mentioned are dental focused. We've built mobile clinics and supported programs that had rad rooms to do imaging. We've done mammography clinics, cancer screenings, tons of testing, outreach. A lot of the most vulnerable among us just need someone to wrap their arms around them, tell them that they love them, and bring them into the fold. So even outreach programs are quite popular. One thing I did want to add is that there are a lot of folks in our country that are trying to create more equitable access. And there's been some pretty loud failures of some large retail organizations. And we think that one of the things that differentiates us is we're not trying to be the healthcare provider in this case. We are trying to support a community health center network of about 1,300 organizations with about 14,000 sites of care already established, already credible. They took care of 31 million of our neighbors last year. It would be the height of arrogance in Greensboro, North Carolina, for us to sit here and think that we can understand a community across the country, but we don't have to, because we have our community health center partners who've been out in the rain and out in the sun doing the work. And we're uniquely able to support their work. And we believe that by doing that, we can turn that 31 million number into 50 million.
And as I continue to work with community health centers in Virginia, as well as outside of Virginia, I'm curious as to what do you think the future of mobile health care?
I'm so excited that you asked, Tracy. We are expecting any day now a grant notification of award. Hopefully, we applied. We think there's a future of enterprise mobile medical where the use case and the equipment and the supplies for the use case are interchangeable. That the mobile platform or the transporter is really just a transporter for these modules. We see a future where they may even be autonomous in 5 or 10 years and be able to deploy at 2 a.m. to set up ready for shop. The nurse practitioner meets them in that community, meets the equipment in that community without needing necessarily an operator to deal with it after hours. We see a future where they're resupplied by drones. We see a future that, that helps with workforce development by having onboard augmented reality training or walkthroughs for procedures that maybe that local, nurse or provider isn't highly trained at. We see a future. One of the other things that we're doing here is we're launching the newest Project Echo for mobile medicine. And we are proud hosts of that, Mobile Healthcare Project Echo. And so we see a future where practitioners from all over the world are convening to create these blue ribbon best practices and document those things, validated sort of processes about how to do it the best, most effective way. So there's just a tremendous amount of work in our future, but also opportunity and promise. And honestly, I see mobile as a way for health centers, health centers and health systems to lead the way to rebuilding trust across our country. I think the core of servant leadership is you go first. And I think that we have sat in our offices for too long and expected people to come to us and be happy about it. And I think if we can go take care of communities, people in those communities will begin to trust institutions again. And I think that changes our country. I think that it might change the world, and it all starts in a mobile clinic with someone who cares.
Our demographic of listeners is quite expansive. So we probably have, folks who, live in the community, listen to our show. We have healthcare providers. We have community health center workers also. We just have a whole host of individuals, the demographics of our show here. So for those who are providers, okay, who've thought about getting into mobile health, right? They've just not made that move. What would be your advice to them? What would they need to consider on what are those things they need to consider on moving forward with doing this?
It's an interesting question. So when we say providers, like health centers or just independent providers?
Now, I know that health centers are a little different, right? The way that the federal government has set up how health centers can get into the business of mobile health, but they still have to have those considerations, right, before they can move forward. And so I think if you can talk about what are those things you have to consider.
I look at giving advice kind of like, a haircut. Like everybody's very individualistic, right? Like my dad was a barber for like 25 years, and my grandfather was a barber too, so I use a lot of haircut analogies. I'll tell you, my dad wasn't just a barber, he was a hairstylist, right, in our town. And when I say that, that means that he didn't just cut men's hair, he cut women's hair and colored and perms, and then he did toupees for men. So he would go to conferences, right, back in the 70s and 80s, these stylists, cosmetology, and he'd come back with the latest European styles, and then he'd try to talk us into like letting him practice on it. Right? Yeah, it was an interesting childhood for sure. Especially I've had you don't even know this. I've had a mullet. I've had a flat top. I've had long hair, rat tail, permed, blonde. I've had all the things. So anyway, something for your listeners. But anyway, so unique the haircut.
I love it.
And so health centers do have a leg up. The program or methodology that we really designed was designed for health centers. So it was not designed for health systems like hospitals or academic research. Like it was to support the health center movement. And so all of our models work like that. The considerations there, I think, are really, we have kind of a 7-step model that it is the community is the first one, rapid needs assessment to figure out what the community wants. Right? Let's remember the audience, like what the audience wants and needs is completely different than what you might want to give them or be suited to give them. So the rapid needs assessment, and then you consider labor, you consider payer mix, you consider all the direct, miscellaneous things, credentialing, service area needs. Outside support, we have like a patronage model is what we call it, to help figure out if operational direct reimbursement and indirect, so we call those dark green dollars and light green dollars, so direct reimbursement and then secondary effect revenue is not enough to support a mobile clinic, which I will say in almost every situation it is. We ran hundreds of these simulations. Like I said, we get 75 calls a week. Health centers, this makes financial sense for health centers. It doesn't only make financial success, we can show significant ROI, like the best ROI for any investment you can make in mobile clinics. The trick is doing it right, not the do it the right way, not the old way. And that's really the song that we're singing. It's like the way that everybody thinks it's being done, you need a lot of philanthropy, you know? But if you do it the other way, this new way, now it makes money for your health center and can support the mission in other ways. The trick is just getting folks out of that paradigm of, well, we know how to do it. Okay, you know a way to do it, right? So considering that sort of stuff,
Right.
a champion,
Right.
we require someone in the organization to wanna. We call it gotta wanna. This is not a program you can assign.
Gotta wanna.
This is a program for someone, a provider in your organization or coordinator, program manager, who's always wanted to do it and who just needs a place, never been in a moment in their career that they could spread their wings and soar when it comes to taking care of, wrapping their arms around the community. So champion's a big consideration. Coaching, if you don't know how to do it, it's like learning to play the piano by yourself. You can do it, but it's going to take a really long time and you're going to be frustrated. If you get a piano teacher, right, they'll walk you through it. The last piece I would say consideration wise after the coaching is time horizon. To look at this less like pole vaulting where you run really, really fast and then see if you make it, and more like, you know, learn to play the piano, right? There's a lot of piano players in my house. I use that analogy.
Yeah.
Where it's a process, and you have to be bad to be good. You have to be willing to be bad. That is the path to getting good. So you just got to try and learn. And I had someone yesterday say they were going to do a program, and they said, what's this? We said, hey, here's the thing. It's a 3-year deal. And they said, oh, can we do a 1-year lease? And I was like, we can, but what for? And they said, oh, well, you know, like we don't want to commit, you know, to 3 years. I was like, you understand this is a healthcare program, not like maybe. And they said, oh, my boss said, I love this. What if we can we sign for 6 months? And I was like, do you expect results in 6 months? And I was like, I don't think you should do it, to be honest. If you don't have a commitment level of any more than 6 months, I just recommend you don't do it at all. Like, this is going to take a second. It doesn't take forever, right? And there's ways to shorten the ramp, but it does take commitment and caring. And you can't just, I don't know, wing it, I guess is the word. That's a horrible strategy to wing it.
Right.
Well, sorry, I was just going to say for decades, so many have viewed mobile clinics as a charitable endeavor that shows up in a parade once a month or at Christmas or whatever. And we don't view it that way. It's inexpensive square footage relative to bricks and mortars that's really flexible because it happens to sit on wheels. And you have an opportunity to find traction in the right community with the right community partners. And if it's not getting traction in the way in which you planned, you can relocate it. And there's an awful lot of flexibility, but it's difficult to change how people's viewpoint of mobile clinics. So we're singing that song all day, every day. And we are getting more and more folks wearing Mission Mobile Blue. And that's only going to kind of help be evangelists for, not for the mobile clinics, not for our mobile clinics, but the way to think about mobile healthcare.
Right. Exactly. And that again is, you know, and I said that at the beginning when we introduced you, that is so very important that you can't just go in this with, you know, this is just a service we're going to provide. It encompasses so many components in order for it to be successful and sustainable. So, you know, gentlemen, I really do want to say thank you for taking the time and hanging out with me and our listeners here on Common Health. You know, when I wanted to, when the team had said, brought this idea of interviewing you guys, it wasn't even, they didn't even really have to make a pitch. Of course, this makes sense, because we do represent community health centers, and a number of health centers have mobile units and are thinking about expanding or thinking about just getting into the business of it. And so it just made sense to get you guys on here so you can talk about mobile health care. And listeners, I hope you heard the part where they said that, mobile health is a part of the healthcare system. It's not just hospitals. It's not just community health centers. It is inclusive of mobile health. And so the moment we lose a unit, and when we say unit, it's an actual mobile truck or whatever, shuttle, think bus, we're losing a piece of the system in your community. So for those that don't have a lot of access to healthcare services, can you imagine if they lose one of their units, especially in the rural area? So it's important, listeners, for you. I'm hoping that we brought you a little bit more information about our healthcare system, but then also the importance of why we need to continue to be mindful of our mobile units and the kinds of services that they're able to provide. I will tell you, listeners, before I let you go, you will find many services in a mobile unit. So you could see, like both Travis and Brad said, you could find primary care services. Primary care meaning you'll have an internal medicine or a family practice or a pediatrician. You'll see dental. You'll see some health outreach like screenings, blood pressure checks. You'll see mammography. But again, it is really a culmination of what you get when you go into your health center or go see your private practitioner. So, gentlemen, thank you for your time. And we look forward to continuing to work with you here in Virginia. And I hope that also folks out there in our listening world will reach out and learn more about mobile units. So thank you.
Thank you, Tracy. We appreciate you investing the time. Have a great day.
Thank you so much, Tracy.
I want to thank my guests for joining me today. And thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit subscribe button and share it with others on social media. Leave a rating and review or visit our website at www.vcha.org. This is Tracy Douglas Wheeler, and thank you again, and I'll see you next time.